Down syndrome. Hello, today we will be talking about Down syndrome, what it is, the chromosomes affected, the inheritance pattern, some of the physical symptoms, treatments, the population statistics, genetic screening techniques used, and a very brief outline of current research on it. But first of all, what is it? Down syndrome, also known as trisomy 21, is a chromosomal defect which causes intellectual impairment and physical defects such as a short stature. Chromosomes affected. Down syndrome is caused by having 3 copies of genes on chromosome 21 rather than the usual 2. The extra chromosome 21 material may also occur due to a Robertsonian translocation in 2 to 4% cases. In this situation, the long arm of chromosome 21 is attached to another chromosome, often chromosome 14. This may be a new mutation or previously present in one of the parents.
Inheritance patterns.
There are no inheritance patterns for Down syndrome, as anyone can have a baby with Down syndrome. People who do are usually genetically normal. Although people who have a child with Down syndrome, there's a risk of 1% that if they have another baby, it will have Down syndrome. And as women get older, the risk for having a baby with Down syndrome increases.
Physical symptoms. These physical symptoms include a small chin, slanted eyes, poor muscle tone, protruding tongue due to a small mouth and large tongue, and these airway changes lead to obstructive sleep. A flat and wide face, short neck, extra space between big toe and second toe, short fingers. Growth and height is slower, where males are on average 5'1" and females 4'8", and they are also more likely to have obesity as they age.
Treatments. Unfortunately, there are no treatments for people with Down syndrome, but their quality of life can be improved by visiting professionals such as doctors and social workers, and by being educated.
Here are some of the population statistics for Down syndrome. Down syndrome is the most common chromosomal disorder. Each year, about 6,000 babies are born with Down syndrome, which is about 1 in every 700 babies born. Between 1979 and 2003, the number of babies born with Down syndrome increased by 30%. Older mothers are more likely to have a baby affected by Down syndrome than younger mothers. In 2002, about 1 out of every 1,000 children and teenagers 0 to 19 years old had Down syndrome. This means that in 2002, about 83,000 children and teenagers were living with Down syndrome. Researchers estimated that in 2008, about 1 out of every 1,200 people had Down syndrome. In 1960, on average, persons with Down syndrome lived to be 10 years old. In 2007, on average, persons with Down syndrome lived to be 47. Sometimes, infants with Down syndrome are born weighing less than 3.3 pounds. These infants are 24 times more likely to die in the first 28 days compared to infants with Down syndrome at a normal weight.
Genetic screening techniques. There are 2 techniques used, and they are screening tests and diagnostic tests. Screening tests are used to determine the probability of a pregnant woman having a baby with Down syndrome, and diagnostic tests are used to determine if the baby has Down syndrome. Research. Unfortunately, there is no research on curing Down syndrome. Most of the research is being focused on making their lives feel as normal as possible and making them happier, which will overall improve their quality of life. Thank you for listening to our presentation.
And we hope you learned something today.
The end.